Well, even though there's no sign of spring in sight, college baseball season is already taking the mound.
And among U of L star pitchers is a young man whose game was nearly benched for good. Medical reporter Lori Lyle explains how Louisville hand surgeon saved his career by saving his pitch.
It was really scary because I had just committed and couldn't hold a baseball. My future was in the hands of him.
The hands of Kleinert Kutz hand surgeon Dr. Tuna and Gabriel Shaw, who 3 years ago had just accepted a scholarship with U of L baseball, wondering if he'd ever throw that first Cardinal pitch.
We didn't have any treatment for a problem that Gabriel had.
Called chronic jammed finger. For most, it swells and then gets better. But with Gabriel, it caused small fractures, pits actually, in the middle joint of his ring finger.
Two defects, two bones, basically no cartilage areas, were grinding against each other.
Oh, that's as much as I could bend it.
And at the end, it was going to be completely arthritic, and he was not going to be able to move it at all.
So doing nothing leaves the finger immobile, and a fusion to relieve the pain also leaves the finger immobile. Dr. Tuna knew about cartilage transplants in larger joints like the knee, but it had never been tried in a joint as small as the finger.
It wasn't an easy decision to proceed with this because if it had failed, then we were going to be doing a fusion for sure. And that meant the end of his career.
But with no other option, Gabriel took the chance.
I've been playing since I was about 5 years old.
Keeping eyes on the big leagues, he put his trust in a rookie procedure.
So this is where the cartilage and bone is missing.
Taking cartilage from Gabriel's own wrist bone, Dr. Tuna made plugs the size of the pits.
So this is basically how I filled those defects with those cartilages.
And after 3 years of follow-up and follow-through on the field,
we showed with an MRI that blood grew into those plugs, and it took basically.
Gabriel scores the success
100%.
With full range of motion, extension, Dr. Tuna says he doesn't need anything else, except, of course, a pro recruiter sitting in the stands.
Hopefully it'll happen.
Lori Lyle, WAVE 3 News.
We wish him good luck. Dr. Tuna says with no signs of arthritis in Gabriel's joint, he's now ready to publish the results of the surgery, and he's hopeful the treatment can be used for many types of injuries in smaller joints.